Dr. Su-Lin Hall is a board-certified urologist. The Instagram is How to Get Ahead book, and the book is How to Get Ahead. Dr. Hall, welcome to the program.
Thanks for having me. Glad to be here.
So tell us about the book, where they can follow you, what they can expect to learn from it.
So How to Get Ahead is basically getting ahead in life in regards to your mental, physical health. I wanted to write this book to increase competence and confidence in intimate relationships by educating people about their anatomy, their physiology, for both men and women, because sexual health and intimacy can actually affect mental and physical well-being.
Oh my God, for sure. I was just reading the other day that just touch, particularly for men, touch lowers their cortisol level by 30% or something. There's a lot of longevity data out that if you're, now, of course, we don't know chicken or egg. Is there people able to have sex because they're healthy, or are they having sex that's keeping them healthy? Probably both, right?
Both, yes. Regular pleasure really does reduce stress. It actually reduces the stress hormone cortisol that mitigates the harmful effect of stress on our heart, our immune system, and our overall health. So intimacy, which I like to describe as in-to-me-see, you have to start from within, enhance your normal, healthy life to be able to share it with someone else.
Yes, that intimacy is a very important moniker to people to kind of understand what intimacy is. And is urology is becoming, like every discipline in medicine, everything's becoming very, very more narrower and narrower. What is sort of your area of urology?
So I practice general urology. So in regards to the male, female, and pediatric urology, but now I've advanced to doing Quantum Health and Wellness Center, where I actually see patients in a holistic manner as well for basically preventing diseases and not just waiting till someone develops the disease. We actually try to do a mind, body, soul approach to healthy living.
Oh, interesting. And, there are certainly a lot of people are taking advantage these days of what we call the PDE5 inhibitors, the medications for erectile dysfunction. But there's a lot of other non-pharmaceutical things to be done out there, both preventive and like sound waves and whatnot, to sort of help in ways that don't require pharmaceuticals.
Yes, so many men don't realize that erectile dysfunction actually can be one of the first signs of cardiovascular disease and diabetes. Sometimes men don't realize if they're starting to have ED, it may be an early sign for more important disease process that's developing. And so sexual health, even though we figure it as improving, yes, intimacy, but it's also to protect our heart, bone health, as well as our brain to improve functionality. So when someone has vascular disease, the penis has smaller vessels than the vessels in the heart. So when you start having obstruction of the vessels in the penis, that may lead to more advanced diseases actually being developed. I had a 30-year-old patient when Viagra just came out that actually wanted me to give him Viagra, and I was like, no, we really need to check your heart. You have a strong family history of heart disease. And I am so glad I referred him, because he had 90% occlusion of his LAD and wouldn't have known that if I had just given him medication. So listening and figuring out what patients have, I know, really is important.
Yeah.
Yes.
Yeah, a man 50 and over, 40 and over, if they smoke, if they got erectile dysfunction, I put them on a treadmill right away. First, before we do anything else, let's see if there's anything going on here. And very many other variations on that theme. You get calcium scans and CT angiograms, all kinds of things now you can do. So many ways your doctor can evaluate that. But
artery calcium scan is, I agree with you, is a great way to evaluate people early, as well as apolipoprotein B and all the other markers, CRP, homocysteine, really good markers in evaluating heart disease early.
You give homocysteine, I know you're doing more wellness now, and homocysteine is a topic that comes and goes, and I get confused about it. Are you worried about homocysteine elevations, and do you do something to bring them down?
Yes, if someone's elevated and has high risk factors for DNA abnormalities or some kind of genetic epigenetic problem that may be at risk, I oftentimes recommend magnesium, which actually binds to NMDA receptors and inhibits calcium, sodium, ion chains developing into the cell, therefore reducing oxidative stress and mitochondrial function, improving health. So even though when I give someone magnesium, they may think it's just for relaxing their bladder so they don't get up as much at night to urinate, or relaxing their muscles so they feel better, it's actually also to help with methylation, which also requires like fish oils, omega-3s, help to convert, which you just talked about in your advertisement about nicotinamide riboside, and to convert that in the body to NAD really can help reduce oxidative stress, but also improves our health in general.
Yeah, I am completely convinced that those NAD pathways are the answer to so many of the, let's just say, the progression of aging and some of the things that people get into. I mean, it's, and exactly, somebody convinced me that the one thing I was leaving out was glutathione. And of course, you can't really get glutathione without, so it becomes glycine and N-acetylcysteine that you got to put together. Because that's the one I've always left out of my assault on NAD. I think PQQ is important. I think resveratrol is important. I think NR and NMN, these are all really interesting ways to do this. And even astaxanthin. But I just left glutathione alone because I thought it's not going to get where it's supposed to go. But I was convinced by a biologist recently that taking glycine and NAC will get it where it needs to go.
Yes. Well, if you have the precursors, including your methylating, so you're actually reducing your homocysteine, you're actually converting it to glutathione, which requires all these B vitamins. Those are very essential in being able to make glutathione yourself. If you're not, then liposomal glutathione is probably the best oral availability. Now, that used to be mainly just liquid, and now recently they came out with pill form. But I think glutathione is helping reducing breast cancers, all kinds of cellular, abnormalities that can develop within a lot of us. And many people don't even realize that they can actually reduce risk for cancers with these kinds of precursors if they're deficient, especially such things as methylation, which includes magnesium, fish oils, vitamin D, and building up our immune system. I think that many people don't realize we're so comfortable with normalizing mediocrity that we're not realizing optimizing our overall health is actually what's most important. But I agree that diet, exercise,
yes, of course,
reducing stress, all of those things matters, and layering it with the supplements is why I try to explain in my book how to get ahead.
And so the erectile function for me was just a way of backing into, my wife said, talk about fatty 15. She brought it up herself, Susan. She brought up fatty acid metabolism and the fact that what we're talking about in that ad is a saturated odd chain fatty acid. That's a novel odd chain fatty acid that has benefits on cell membrane oxidation. So that's a very unique, specific finding that came out of dolphin research. Thus, the dolphins in all of our ads. And Susan, the ad that's on Instagram now. Your husband?
I love that ad. You guys look great. And my husband started taking Fatty 15 as well. Yes.
Good.
We actually try to practice
put a new one up on it.
Yeah.
It's me. We only get behind the stuff before we start preaching. If we're into it, we like it, we're sold on. We are convinced of the science or the nutritional benefits. We do it. But she put up one on Instagram just now that Caleb and I couldn't stop laughing about. So stay tuned for that one. So I wanted to go from erectile function to prostate cancer because prostate cancer is an important topic. It's a leading killer of men in this country. It's not discussed enough. It is so treatable. It is so manageable if you get it right. And we're even zeroing. I work with the Prostate Cancer Foundation, and I listened to a lecture this morning about tumor markers that are going to be, we're going to be able to dial in exactly who needs a biopsy, exactly who can tolerate active surveillance, exactly who's likely to go on to more aggressive disease with these scores that we're developing. But our problem is actually more, I use the word gross because it's big. The big problem we have is men don't get tested. And it is I'm a prostate cancer patient. I had a prostatectomy 14 years ago. No effect on anything really. Certainly less than aging itself, I would say, effect on my biology. And I had to have radiation 10 years later, which is kind of interesting. I had some sort of recurrence. And I had a Gleason 6, which is it's all kind of weird, but it shows how challenging prostate cancer is and how each tumor is different in every patient and has to be highly individuated. But men aren't getting screened, so they're getting picked up too late. And Black men in particular, it's just tragic. They tend to have more aggressive disease. And if they're going to have more aggressive disease, we got to get on it fast. And if you aren't being screened, we're there too late. Tell me your thoughts.
That's actually the problem, because I think that Black men have the highest incidence of prostate cancer, and they actually have 2 times the incidence of dying from prostate cancer. And we're so good as urologists at treating prostate cancer, this should never happen. I mean, if caught early, what a difference in management. We check PSAs, but the problem is women go to the doctor all the time for PAPs, but men are not usually going to see us unless they have a symptom. The problem is the symptoms don't occur until you have advanced disease. So men need to be educated, especially Black men. They should be evaluated at age 40 with a PSA, especially because of high risk family history, so forth. Even though the Caucasian incidence is 1 to 8 versus 1 to 5 in Black men, 160,000 Black men per 100,000 is actually a very high number that we should be really addressing this issue to educate African American men more about this, because socioeconomic issues is one of the issues. Men are sometimes afraid of obtaining a digital rectal exam, but now we're really doing more PSAs as well as MRIs for further evaluation of prostate cancer, rather than just a finger exam, which there's, I think, one of the reasons they don't want to be evaluated.
Well, that's correct. And so no more digital rectal exams, gentlemen, so you don't have to worry about this. We didn't like it either. You don't have to do that anymore. It's just a blood test, as we've been saying at the PCF. And the thing that as you said, we don't go to the doctor. And even when we have a symptom, we go, I'll wait till it kills me, especially if it's going to do something to my penis or my sexual functioning. I don't want to know it. So we put our heads in the sand. What I want to emphasize is, if you get this early, it's fine. It's not going to affect any of that. It's not going to affect, it's just going to take a cancer away that really can kill you sometimes. And really, if you completely ignore it frequently, even though it's slow growing in most cases. It's just a tragedy to me. And in my experience, when I talk to African-American men, I still don't get anywhere. I only get when I talk to their daughters, sisters, and mothers and grandmothers. Then I can get them into the doctor's office, especially their grandmothers. But I can't go direct. So we need help. We need help. Throughout the family's got to help us get these men in.
And one of the reasons I wrote this book about how to get ahead was to get ahead of these diseases. I educate people about the erectile dysfunction, but then also, what is the anatomy? What is going on? We as women will go to the doctors. We need to encourage our husbands or brothers or sons or fathers to be evaluated, because this is, on poor symptoms, not very extensive symptoms. And most diseases for men are underreported. Just for instance, low testosterone. Many men have fatigue, weight gain, sleepless nights. They sometimes even present with depression, but not like how women present with crying or talking to your friend. They may have anger or overworking. But these may be signs of another disease process undergoing low testosterone. But people were worried about taking testosterone with history of prostate cancer. But as urologists, we're able to evaluate that and recommend who is an appropriate candidate for management versus who's not.
Yeah, like I would absolutely be on testosterone replacement if I hadn't had prostate cancer. Right. And then even after cancer, if I hadn't had a recurrence. It's the recurrence that puts me in that category that kind of like, sorry, not for you.
Right.
But there are plenty of ways to naturally raise your testosterone level. Right.
There are natural
Anyways,
ways,
with,
yes.
don't overdo. Yeah, don't sleep
Diet.
adequately, resistance
Yes.
training,
Resistance
diet.
training.
Don't do the excessive cardio. Excessive cardio drives it down. Have
Yes.
adequate sexual experiences, frequency that raises testosterone. Yes. Well, listen,
Healthy
Dr.
sexual
Hall, we got to
pleasure.
wrap this up.
Yes.
Yeah, there you go. Well, get her book. It's a good book. It's comprehensive. It is about leading your health. How do you take a topic like that and think about health? It's a way to get into the topic of being healthy and being happy ultimately. So, Dr. Hall, I appreciate you writing the book. Where do you want people to find you?
They can find me on Instagram, Sulin Hall, or How to Get Ahead book. Also at Quantum Health and Wellness Center, we can also be found on X at Sulin Hall, HTGA, lower score MD, or at anywhere on Instagram or Facebook for Quantum Health and Wellness Center, as well as Sulin Hall MD. And thanks so much for having me. I
Thanks for
really
joining
wanted
us.
people to know,
You bet.
about the book and their health. Thank you.
Great. I think we raised the awareness, and I hope they'll come look, at least get on that Instagram or the Facebook. Appreciate you being here.
Thank you for having me. I appreciate you.